Namaste, I am Dr. Siddhartha Ghosh. I am a senior consultant neurosurgeon and head of the Department of Neurosurgery in Apollo Hospital, Chennai. Today I am going to talk common symptoms of neurological disorders which the common people may not be aware of, and which if it comes, what they need to do. So, we all have headache, like every human being get headache sometime or other. So the normally common headache we don't have to worry about. But if somebody gets a headache which lasts for quite a few days, at least for 2 weeks or so, and particularly to one side or any part of the brain, any part of the head, and if it is on the top associated with vomiting, then I think it needs to be investigated, provided this is not something which has been happening like what we call migraine over a period of time, like for months or years. So any new onset of headache with or without vomiting, you should take care and think about that seriously, and take an opinion from at least a physician, or if possible a neurologist or a neurosurgeon. That is one thing. Number two is, if somebody, a normal person who doesn't have any problem of what we call is seizures. Seizures mean sudden convulsion of one side of the body, or a generalized convulsions with loss of consciousness with an late onset, and healthy young adult otherwise, or even elderly gentleman who is the first time he had experienced something which we normally know as epilepsy. So if that happens, definitely that needs to be taken seriously, and you should definitely seek the advice of a consultant, again either a physician or a neurologist or a neurosurgeon, because these are the things which we normally don't have. If we have, it has to be taken seriously. Number three, one of the important things, if somebody who has developed sudden weakness of one side of the body, or it's a gradually progressive weakness. Whenever something happens suddenly, we call it as a stroke. But stroke can be just because of the blockage of one blood vessels, or it can be due to something else. So especially if, for example, if somebody is having some problem, a tumor related problem or something, so that he or she will have a weakness over a period of time, maybe of a period of a week, 1 week or 10 days or a month. But somebody who is having a sudden weakness, it can be either a stroke or it can be a bleed. Now bleed can be, if it happens to a young person, that bleed can be due to rupture of a small point in the blood vessels, which we call it as an aneurysm, or it's abnormal communications between the vessels of the brain, which we call it as arteriovenous malformations. So anybody who has got a sudden headache associated with severe headache with vomiting or with weakness, he or she should definitely again contact a doctor. Last but not the least, which I think should be very important for us to share this knowledge to the common people. If you find in one of your family members who has been absolutely all right, suddenly has some impairment of what we call higher mental function. For example, as somebody who has been very quiet, reserved person suddenly starts talking very is talking too much, or there is some sort of personality changes associated with some sort of other problem like urinary disturbance and all, which or any difficulty in walking. All these are serious neurological disorders which again need to be consulted and to be seen by a neurophysician. So these are the common symptoms. I thought there are so many other symptoms which happens in various neurological disorders, but that's do not happen very commonly. What I wanted to bring it to your notice, these are the common symptoms, and they are the things which can happen in our life, but not that which happen once in a while. Having said that, I don't mean that it happens once in a while and then you have to, like you have got a headache suddenly for a day and then you don't have any headache, you don't have to worry about that. But the things like that is a late onset epilepsy, seizures, or a sudden weakness or a gradual weakness of one part of the body, or a difficulty in vision, or gradual impairment of your vision, or the loss of vision on one side of the field of vision. These are the things which are, or your impairment of your higher cognitive functions. These are the things which definitely need to be considered seriously, and you need to consult a doctor as soon as possible.